Yeah. Yeah. Okay, ladies and gentlemen, we're so grateful for the speed with which you move the great distance that is necessary to move in this convention hall. We wish to welcome you to the final lecture on this Saturday, May 5th, and we'd appreciate that those that are talking, if they could just step outside into the hall so that we can start our next lecture. Our next lecture is going to be one that is worth your getting out of bed this morning for. It's Margie Adelman. She'll be speaking to us, in fact, she's the author of The Miracle of Urine-Therapy. Margie Adelman is a naturopath, one of the few that you have in Florida because of your restrictive laws. She has a private practice in massage therapy in North Miami, Florida. She gives consultation on nutrition and urine therapy and is a co-founder of the Water of Life Institute and co-author of the book, The Miracle of Urine Therapy. Margie Adelman is a frequent guest on local and national TV and radio shows, and might I congratulate this overflowed audience for your open-mindedness and willingness to look at something brand new. Give yourself a big hand at the same time you welcome Margie Adelman here, please.
I second that. I want to thank you all for having an open mind and attending this meeting today. I just first would like to say that I would... What's that? Oh, I'm sorry. First of all, I'd like to introduce my partner, Dr. Beatrice Barnett, and she is also the other co-founder of the Water of Life Institute and authored a book by herself called Urine-Therapy, It May Save Your Life. And I'd like to give her a hand for her work in this field. Okay, I'd like to just run through what we have here, what we sell at the Institute, and that is Urine-Therapy, It May Save Your Life. This booklet deals with the medical aspect of urine therapy and the components that are in urine and their physiological effect on the body. So this is a very good introductory booklet. It does go over some of the practical application as well. The Miracles of Urine Therapy, that's the book that we co-authored, and this is a very good introductory booklet as well, and it deals with a lot of how-to questions, practical applications, goes into some of the metaphysical roots of urine therapy and some of the medical application as well. And this book called Urine-Therapy, Self-Healing Through Intrinsic Medicine was written by Dr. John O'Quinn, and it deals mainly with the metaphysical aspect of urine therapy. And we put out a testimonial tape of testimonials from all over the world. There's incredible stories on here, and this is $7, and we sell this through the Institute also. We also publish a quarterly publication called the Water of Life Network News, and right now we have 7 chapters across the country and one in Toronto where people are gathering and having support group meetings and sharing their experience with drinking their urine and their healing experiences with it. So this is a very good way to keep up to date with what's going on in our organization. Okay, I guess we should start with the basic question, what is urine therapy? If I go off the microphone, will everybody be able to hear me? No? Maybe, is that reached? Okay. Okay. Is that better? Okay. Okay, urine therapy is the most ancient, primordial, simple therapy known to mankind. It's a lot of the theories or the basis or the principles that I give you are going to seem very simplistic, but that is where it emanates from. So we'll go into this board now, try to explain why we should take back our own urine, because a lot of people, most people, believe that it's a toxic excretion and something we should not take back into our bodies. We have to look at nature. Nature doesn't waste anything. And if you look at the cycle of nature in a tree, you'll see that in the spring or the summer, the tree is in full bloom, and in the fall, the leaves fall off the tree, fall to the ground, and in the winter, they will fall into the soil, remineralize the soil, go back in up through the roots and remineralize the tree. And again, it's just a full cycle of nature. That's one complete cycle. So nothing is wasted. The dead leaves serve a purpose. They go into the soil and they are the best compost for any tree. Then we have Mother Nature's own water cycle. Okay, you have the clouds which pick up the water from the ocean, goes over the land and drops the water on the land. cleanses Mother Earth and goes back into the ocean. Again, a complete cycle of nature where nothing is wasted. Everything has its complete cycle. Well, the human body is very similar. It has its own cycle, and that is the blood cycle. And this, of course, is a very simplified version of the blood flowing through our bodies. If the heart pumps the blood out through the lungs, eventually it ends up in the liver. Now, the liver is where the blood is detoxified. Okay? All of the toxins are taken out of the urine in the liver and stored either in the liver or the gallbladder in the form of bile, which are later eliminated in the form of feces out through the large intestines. After the blood leaves the liver, it goes to the kidneys. Now, the kidney's major function is to balance out the blood, the elements in the blood. For example, if you take vitamin B or vitamin C and your body utilizes what it needs, it will eliminate the excess amounts into your urine, and you can observe this phenomenon by, if anyone's taken vitamin B complex, or that the next time that you urinate, you'll see that your urine is very yellow from the excess of vitamin B in your body. You just urinate it out. So any excessive amounts of any minerals or enzymes or anything that's in your blood that's in excess, the kidneys will eliminate that into the urine. Okay? Okay, we'll look at some of the basic components of urine. Urine contains 95% water, 5% vitamins, such as minerals, proteins, enzymes, hormones, antibodies, and amino acids. Now, I don't see anything toxic here. These are all vital elements for healthy, functioning bodies. Then we get into some specific elements. By the way, there's over 200, there was a free study done, and there's that we know of 200 components in the urine right now, and they do believe that there's actually over 2,000 components in the urine, so we don't even know exactly what's in there as of right now. Okay, uric acid. Now, all of these components that are listed here these are medical studies that these have been taken out of in showing their physiological effects on the body. Uric acid has been shown to help prevent cancer and increase the lifespan. The anti-neoplastins return the cancer cells to normal cells. The H11 factor, seizes of cancerous tumors, decreases. And the urokinase, okay, there's a very good story about that. There's a company called Enzymes of America, and that's out of Utica, Michigan, that goes around to all the public urinals and collects the urine from these public urinals and sells it to the major pharmaceutical companies, and they extract the enzyme urokinase out of it, and which is in effect sold back to the patient because urokinase is being used as a very, it has incredible results with pulmonary embolism and heart disease. It's a artery dilating agent very similar to nitroglycerin. And I think you can receive one of these treatments for about $10,000, if I'm not mistaken, up in Boston. So what occurs naturally in your urine, you can pay $10,000 for and get a treatment of that. They also said that the Pope, when he was here, he urinated in one of the urinals, and they claimed to have his urine in one of their, okay, and proteose helps with allergies. It has been shown very effective with allergies. Factor S has been found in urine, and that helps to induce sleep for insomniacs. Urea helps with protein and fat metabolism. Then there was a study done in Italy that there was actually a hormone extracted or found in urine that was called the no-name hormone. It regulated the diencephalon and actually balanced out the weight of people. If people were underweight, it brought their weight up. If people were overweight, it brought their weight down. Okay, I don't know if any of you have heard of Dr. Brzezinski. He's been, on the forefront of cancer research, and he's had a lot of trouble. But I think just recently the FDA has approved him to go ahead with his study with anti-neoplastins. He had a 97% success rate of cancer cells realigning themselves. And what he did was actually extract these anti-neoplasms out of the urine. He called them directin, and he's producing them synthetically now. Where he used to extract them from the urine, he's producing them synthetically. And he's had an incredible cancer study. I don't know if any of you are familiar with him, but his name is Stanislaw Brzezinski. And he does take that out of the urine. And there's Dr. Lowe. He's a pathologist, and he had pain control in cancer patients, 98% success rate. There was no sedation necessary when urine was applied, both topically and internally. Also, it inhibited the growth of the tumor. So it either seized the size of the tumor or it actually decreased the size. Okay, and there's Dr. Eckert is one of the doctors in California, and there's another doctor also that has had very high success rate with allergy patients, and that's 80%. It's very high when it comes to allergy. I don't know if any of you have heard in the news just recently, it made national news that Dr. Burrell in Canoga Park, California, just had his license revoked because he was treating patients with their own urine injections. He was taking the urine from the patients and he was re-injecting it back into them. And he's found it very effective with allergies because it'll start to desensitize whatever you're allergic to when you ingest the urine or take it back into the body, you recycle it, your body produces an autoimmune response. So you actually start to desensitize your body to any kind of allergen. And his license was just revoked because a lot of people had gotten together to, they said that it was an obnoxious therapy and, they came down on him. So this was in the news just recently. Okay, urine therapy produces both immunity and tolerance. Okay, we say, how does it work? Okay, actually what happens when you drink your urine is that you will produce an autoimmune response. There have been some studies done in Germany that when patients had gonorrhea, they actually took the crude pus from the gonorrhea and put it on the tongue of the patient. And I know this sounds very disgusting, but it actually produced the autoimmune response, and people had their gonorrhea cleared up almost immediately with it. So what happens is a fraction of a urinary protein binds with a specific pathogen. Pathogen is the foreign invader. It binds with the pathogen and neutralizes it or inactivates it. So this is how it works. And this was a study done by Merler and And the International Immunology Institute has done a study that says that UT enhances and stimulates the immune system, mostly the T-cell population, and that the T-cell counts were restored to normal after UT treatment. And I believe this was with urine injections as well. Also, in Texas, there were 3 clinics. There was a man by the name of William Hitt. He was treating allergy patients and AIDS patients. And he was also closed down because the FDA told him that he would have to obtain a permit to use urine as a drug. Now, we all know that every time we go to the bathroom, it's different, and that it varies from individual to individual, so there's no way you can patent urine. So it was impossible, but what happened was all his patients went into court and testified for him in his behalf, saying that their key blood tests had improved and that they were feeling better and that this therapy was working for them. And the judge still ruled that he had to get some kind of FDA regulation or FDA permit to continue. So what happened was that it went underground, and we hear through the grapevine that these people are actually centrifuging in their own washer machine in test tubes their urine and re-injecting it. And I might add here that while I don't recommend to inject the urine because there is a process involved with it, and I don't think it's absolutely necessary to do that, I think it's better to drink it in its whole state, that it is very effective. So some doctors have used it and they're not aware that you can drink it, but it is effective in that way as well. And the government did shut down the clinics. Okay, and that's it for the board. Now I'd like to go into some of the practical application, and before I do that, I'd just like to say a few words about the metaphysical aspect. I won't get very heavily into that because we don't have much time, and most of you are probably interested in how to. So, but in our research, and over the last 8 years that I've been drinking my urine, we found that its roots came out of ancient texts and sacred books such as the Bhagavad Gita and the Aquarian Gospel and the Bible. There were some references to it, and this is my own opinion, that drink thy waters of thine own cistern could have possibly meant that we were in fact meant to drink our urine. And there are several passages in the Bible that I think refer to the drinking of man's own urine. And those are all documented in the book, so if you're interested, you can read all of that. But when we went to India just recently, it was, of course, very widely accepted because it came from their own roots in their ancient text. And we met Margie Desai, and he was the ex-prime minister who is a very staunch follower of urine therapy. And he was on 60 Minutes, I think in 1976. He was on 60 Minutes, and he told the world at that point that he drank his own urine. He was about 60-something years old then. I think he's 96 now, and we had the honor of meeting him. And he is in fine health. And he totally believes in urine therapy, and he was very honored to meet Dr. Barnett and myself, and said that we should continue our work in this field because it does help a lot of people, and of course it's free, and it's nature's cure. So, while the medical findings are very well taken, and it's very good to know that there are like 800 specific studies that have been done and published in prestigious medical journals about the efficaciousness of urine. Primarily the injecting or the extracting of the isolated components. It is a very effective treatment, and it did come from a very sacred place, and I think that it does work on your body, your mind, and your spirit, and it does work on all three levels. And I think that natural healing is, of course, people know about holistic healing. You have to balance out those three aspects of your being. You can't just treat the symptom. You can't, that's the problem with conventional medicine. And while urine is not a panacea, and it is not for everyone, it does have its place, and it is effective, and it does work for some people. So, we like to say to give it a try. We believe in it. We've seen some miracles with it. We've had AIDS patients and cancer patients heal themselves. And again, the body is doing the healing. We don't claim to cure anything. The body is doing the healing, and you just have to assist it with a natural, healthy diet. And that's something that's very important as well with urine therapy, that it's very important to have a good, healthy diet, and we don't recommend to have a very high protein diet when you do your urine, when you drink your urine. It's better to render a more alkaline type urine. So if you eat a lot of protein, you're going to have a more acidic urine. And I don't want to get into the technicalities of that, but just we recommend a vegetarian or semi-vegetarian diet while you're drinking your urine. Most people want to know, how do you embark upon this therapy? Well, we say that the first morning urine is the most potent elixir, that to eliminate the beginning of the flow and the end of the flow is the most important thing to remember. It's not important if you start up with 2 ounces or 3 ounces or 4 ounces. You can start any way that feels comfortable to you. The most important thing is to get over the psychological part of it, of course, because it's an obnoxious thought to drink your urine. The first time I did it 8 years ago, I thought this was the craziest thing that I had ever done. I was very ill. I had hypoglycemia, and had a lot of health problems as a child, and a succession of events led me to a book called The Water of Life by Armstrong, a man in the 1940s who wrote a book and treated thousands of patients with their own urine. His method was very radical. He fasted his patients on urine and water, which Dr. Barnett and I have modified because you have to change, with the way our culture has changed and what the society that we live in. We don't recommend fasting on water and urine alone. I think that juice fasting and urine is a better way to go about a urine fast. And so to begin with 2 or 3 ounces of urine is good. And what happens is, okay, let me go over the beginning of the flow and the end of the flow. The philosophy behind eliminating those two things is that in a man, the urethra is about 7 inches long, and in a woman it's 3 to 4 inches long. A man actually renders a more sterile urine than woman because their urethra is closer to the outside of their body. And if there's any bacteria, building up on a woman's urethra, the first part of the urine will actually flush it out. And if you ask anyone, any doctor will tell you that urine is basically a sterile fluid. It comes directly from your blood. It is the watery part of your blood. And in most cases, they usually take urine, or they take your urine or your blood to find out whatever it is that ails you in the first place. So based on the homeopathic principle of like curing like, you can understand the principle of taking back the fluid that is produced by the greatest laboratory in the world, your own body, and you can understand that each urine is specific to your own specific needs, and that you can't take one medicine and give it to 10 different people and expect that it's going to be effective for all 10 people, but you can take someone's urine and recycle that, and their body will produce precisely what they need to heal themselves. So let me get back to the practical. The end of the flow, it is believed that if there are any toxins or unwanted particles in the urine, that they're eliminated at the end of the flow. It has something to do with the density of the particles. Let me mention a word about toxicity. If your bowels are functioning properly, then the bowel really has the major role of eliminating the toxins out of the body. Most people's bowels don't function properly. And so people then are concerned, well, then am I drinking a toxic solution because my urine, the toxins will overflow through the kidneys into the urine, and when I recycle that, well, I say at that point that the poison actually becomes the antidote, and that it's in such minute concentration, it's in a homeopathic concentration, that when you recycle, you're, again, producing an autoimmune response. So that is the answer to that question. If you begin, let me tell you what happens when you begin drinking urine. As with any kind of natural healing, you will go through a period of detoxification. Urine is a very, very strong surfactant. It goes in and it will actually clean your bloodstream. I mean, it will just, it's a very strong solvent, basically. And it will act as a magnet. It will magnetize all of these elements into your colon and through your blood and lymph system to be eliminated out of the body. Now, you will go through a healing crisis if you have, depending on, your state of health or toxicity, and how much you take in, how much you ingest. So if you are going into the therapy, we recommend that you start up with just a little bit to see how your body reacts to it, and take it from there. If you feel that you're detoxifying it too quickly of a rate, then you can lessen your dosage and continue again, increase your dosage as you feel more comfortable with what's going on with your body. Because at the same point that your body, your physical body will be healing, your mental and your spiritual will be healing also. And so sometimes I hear a lot of people say, well, they feel euphoric or they feel very depressed. Well, urine does contain a lot of hormones, and we know that hormones have a lot to do with depression and euphoria and all of that. I really do attribute it to the urine therapy, because I had been eating a very good diet up until that point, and I really didn't feel that I was completely healed. I didn't feel that internally that my organs were regenerating, that my pancreas was doing its job, functioning properly. I felt that there was something still unbalanced, and it wasn't until after I started drinking my urine that I noticed all these symptoms starting to disappear, along with a lot of other little things, such as I never had a biopsy, but I had a lump in my breast, and that went away, and I had a lump in my wrist. I did a lot of massage. I think I had a ganglion cyst, and I used to apply it topically, and that dissipated as well. And also my skin got very soft. I rub it on the outside. The external application, at this point I'll mention, that is very important as well. Any of you that have skin problems, incredibly effective with skin problems, eczema, psoriasis, athlete's foot. We have several people that have had, voracious cases of athlete's foot and have applied it topically and have tried to get rid of their athlete's foot for years, and just within a matter of 3 days have eradicated, the entire the entire foot just regenerated itself. All types of skin disease. I had a woman that had psoriasis all over her arms. She was applying her urine, and it started to go away very quickly. So we have many, many stories about external application. It can also be used in the eyes as an eye wash. Many people think, oh well, that would sting. It's not. It's a saline solution, and it's really soothing. When you wash your eyes out with urine, it's very soothing. If you have an ear infection, drop some in your ears. It's very good. It works very well with ear infections. Also enemas. You can use it with enemas. You can dilute your urine with your enema with water and do an enema. It's incredible. I believe in colonics and enemas. And I mean, the difference is just, there's a vast difference when you do an enema with urine. You just get a very effective enema. You really release a lot of toxic matter that's been built up in your colon for a long time. Let me see. Externally, you should use older urine. Never drink old urine. Only use that externally. You can let it sit for 1 or 2 or 3 days. I've known people to leave it for months and months. It gets very, very bad smelling. I mean, it really smells like ammonia. It's very hard to take. But the longer you let it sit, supposedly, the more effective it is. For me, myself, I prefer 1 week old urine if I have a skin problem. Even if I don't, it's very good to rub it on your body. It's very effective because the skin is the largest organ in your body. It will eliminate toxins as well as you will be nourishing at the same time. The elements in the urine will be nourishing your skin and going into your organs in that manner as well. So external application is very important. If you're going to fast on your urine, it's very important to remember your blood pressure drops when you fast, and sometimes you will experience minor heart palpitations. If you rub it over your chest, it will alleviate that almost instantaneously, because I've done fasting on urine and I've had that experience, and I know many others that have done the same thing. And so just remember to rub it over your chest area at that time. Again, the healing crisis, the most crucial point in the healing process, and that needs to be to get over that point. Most people think that they're becoming toxic while they're drinking the urine, and they get very afraid, they get very scared, because of course we know it's one of the most unconventional healing methods known, this day. So there isn't a lot of information about, there aren't a lot of people out here talking about drinking their urine, so that's why we've created our support network. But that is the most crucial point to remember at that point, to keep going or to seek support and talk to others that have gone through that. And it is more radical than just doing a fast, okay? I've done fasting with water and I've done fasting with urine, and the basic difference is that you will keep eliminating while you're drinking your urine during a fast. And I've known, my own experience, when I've done fasting with water, that you stop eliminating, and you really need colonics and enemas to help you through the fast. But while drinking the urine, your body still eliminates. So I noticed that difference. I also noticed that my energy levels didn't go, dip so low and so high, that it was really, I felt like I was eating. I felt like I was getting nutrient from my urine, that I was being nourished with my urine. And I just went through the fast. I did a 12-day fast and went through it with relative ease and no hunger. So it is very effective. Now, it depends on your state of health whether you want to do a fast or whether you just want to take it in as a daily regimen. A lot of people say, well, you're healthy now, why would you drink it? I do use it as a preventative. And yes, I have gone off it for periods of time when I felt like it. Really, your body will tell you, whatever you feel comfortable with. There is no set way with urine therapy. People come to me and ask me, well, I drank 3.5 ounces today. Is that okay? It's not really that important to get that technical. Just a little bit, whatever you feel comfortable with. And you will notice the changes that occur. And you have to really gauge it to what your own personal, what you can accept for yourself. So at this point, do we have any questions? Because I know we don't have a lot of time. Yes? No, you can leave it. I put it in a glass jar. Don't use plastic. Use a glass jar and put a lid on top, and put it outside. No, it does smell very bad, so you will want to definitely cap it And when you do your urine rubbing, try to do it in a well-ventilated area. Don't get it on your clothing or your towels or anything. It does smell very bad, and it is offensive. Yes, ma'am. I'm sorry, I'm answering this woman right here. Oh. Mm-hmm. Okay, when you fast with your urine, you can drink it 2 or 3 times a day. There's a lot of different ways to do it, and Dr. Barnett and I give private consultations on that. It really has to be designed for your specific needs. It's hard for me to generalize to you and tell everyone in this room how to fast on their urine. There's a lot of different ways. You can do it 2 or 3 times a day, or you can drink all that you pass. Usually, basically, you'll notice that when you start drinking your urine, just do this simple test. When you urinate in the morning, look at it under a light in a glass, and then urinate at night and compare it to the one in the morning, and you'll see that your body has distilled over the course of the day. The one in the morning is super concentrated and very dark, usually, and very yellow. The darker, by the way, the darker and the cloudier your urine is, usually indicates a higher level of toxicity or disease. So the clearer your urine is usually will indicate if a state of health or not. And also your diet has a lot to do with it. So if you're eating a lot of meat or proteins, it'll be very cloudy due to the phosphate content. Mm-hmm. Mm-hmm. Yeah, well, there's been studies that have shown that urine is an antiviral, antibacterial, antifungal, and these are medical studies that have been done. And there are a lot of medical doctors that are familiar with urine therapy and support it, but a lot of them won't go on record as saying so because they're, of course, afraid of the of the flack that they'll get of losing their license, just like Dr. Burrell did. But they do support urine therapy. Dr. Barnett met quite a few doctors in Europe that are very open and use it in their practice over there. It's very common over there. And the doctors actually assist their patients through using urine. Yes, one of the effects... Right. One of the effects of the healing crisis, the body will purge the toxins any way that it can, and of course we know that the bowels are one way of elimination. Mucus, coughing, the nasal passages, any orifice that the eyes are a way that the body gives off toxins. The skin, any kind of boils, fever. The worst thing that's ever happened to anyone is a vomiting. And those have been in the cases of AIDS and cancer patients that are very toxic. But most people only experience, like this woman here said, loose bowels. And it's really not like you're sick. That's not the feeling. It's just a very flushing feeling, like your body is flushing out. It's like rotor-rooter. Myself, I drink my first morning urine almost every morning. Like I said, whatever my body gives off, if I'll eliminate a little bit in the beginning and a little bit at the end and catch the middle part, and I drink that. And a lot of people want to know, what does urine taste like? Urine tastes, have you ever gotten a gulp of seawater? Okay, it's very salty water, that's all it tastes like. Most people don't urinate a quart of urine in the morning. Yes? Well, you don't have to drink a quart of it. Like I said, you can start up with 2 or 3 ounces, maybe 4 ounces, and that will be sufficient because it is homeopathic and it will work even if you take in small amounts. Yeah, I take it every day. Mm-hmm. There was a study done that showed that the urine of febrile patients, meaning when you have a fever, that is actually the best time to drink your urine because of the macrophage, that the urine will actually bring down fever. And people say, well, if you're sick, can you drink your urine? Well, of course, that's the best time to drink your urine because your urine will contain precisely what you need. I felt many times over the last 8 years that I was just about to get a cold, maybe the beginnings of a sore throat, and immediately I would drink a glass of urine or gargle with it. The sore throat is gone instantaneously, and my cold never developed into a cold. I haven't had a cold in as long as I can remember, as long as I've been drinking my urine. Once a day. And let's limit one question per person so we can get around the room. Yes, ma'am. I'm sorry. Uh-huh. Okay, everybody has devised their own method of using it topically. My method is that I put it on a naked body and I let it dry. You don't have to leave it on all day. Just 45 minutes will be sufficient time for it to seep into your skin. The best thing you can do is put it on and lay in the sun for a few minutes, 10, 15 minutes, and the heat alone will help it be absorbed into the body. No, yeah, after 45 minutes you can rinse it off. Okay. Okay, 1 second. Right. 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 That's right. The fresh urine doesn't smell, and you can use that topically as well. You don't have to use the old urine, but if you have skin problems, sometimes it's better to use the older urine because the ammonia content gets very concentrated, and it's much more effective. Yes, ma'am. Okay, there's different ways to do external applications. You can use compresses. You can mix it in poultice. You can make a poultice, an herbal poultice with the urine. Basically, any kind of herbal poultice that you would use water, you could use the urine instead. Okay, and you could just leave it, make a compress, and put it on there, and keep remoistening it. Use 100% cotton if you can, and put it on the cancer that way. Don't rub the cancer. Just make a compress. I'd say about a half an hour, 45 minutes. Either that or you can wrap it up. Another way to do it is to wrap it up, make a compress, and then just keep remoistening it and leave it on all day. The more, of course, the more you leave it on, the more effective it is and the more it'll work. I'm sorry? No, just the urine. Just the urine. Yeah. Yes. Mm-hmm. Okay, that's a good question. She asked, her husband is receiving chemo and radiation. One thing I didn't mention that's very important, we don't recommend at all or advocate the use of urine with any kind of recreational drugs or any kind of medical drugs, any kind of prescription medication. It's totally contradictory and it can be harmful to your health. You will build up toxic levels of the drug in your body. So it just doesn't mix. You either have to go one route or the other. I have a lot of patients come to me and say, well, I'm on this medication. I'd like to begin drinking my urine. Can I do that? Now, yes, you can start drinking your urine as long as you're going to wean yourself off of the medication. And I don't recommend, that's a personal choice that the patient has to make themselves. I don't tell people to go off their medication, but I will tell you that I don't recommend for people to stay on medication and do urine therapy at the same time. Mm-hmm. Maybe we can talk after the meeting so I can answer more general questions. Okay. Yes, ma'am? Yes, of course. The book will answer most of your questions. Mm-hmm. Yes, if you eat garlic or asparagus or fish, it's whatever your diet is, the next morning you're going to smell it in your urine. And so really your urine acts as a very good food checking quality system. If you're eating very salty food, your urine is going to be horribly salty. And that's one thing that I've noticed is my urine has actually helped me to clean up my diet and I know when my urine tastes like a vegetable broth, I mean it's not even salty anymore, that it's very clean and I'm doing the right thing. And also over the period of 8 years, I'm still detoxifying you. We're always exposed to very high levels of toxic elements these days, the air, the water, we're just bombarded. Our atmosphere is bombarded. So you are continually detoxifying. It's not just a one-time thing. It's a process of natural healing. And you can't become impatient with it. A lot of AIDS patients come to me after 2 months and they say, well, I'm not healed. And I say, well, it took you a lot longer than 2 months to get your disease. Give nature a chance. Nothing is wasted in nature, and nature takes time. It takes longer, but it's more effective. The lady in the back. Okay, I've been asked this question many times. It's a good question. A lot of people want to know if they can dilute their urine, put it in juice, if they should drink it immediately when it comes out of the body. For me personally, the thought of cold urine, that really repulses me. I drink it when it comes right out of my body. Some people have the exact opposite. The thing is, you can't leave the urine outside too long because it does decompose very rapidly. So I would drink it within a few minutes after. It's just like when you juice carrots. It oxidizes very rapidly. You have to drink your urine basically a few minutes after it comes out of your body. Mm-hmm. No, it won't interfere with that. In fact, it won't interfere with any kind of natural modality. It really, one enhances the other. And if you're taking vitamin and herb supplements, it's very economical because you're recycling all of that. So you can really take less of what you're buying, and you will be recycling and getting benefits from those things over and over again. Yes, sir.
Does that also include radiation?
Oh, yes. Chemo and radiation is very toxic therapies, yeah. Yeah, yep. They're good for sunspots, allergies. I'll just go over some of the things that we've seen respond to urine therapy. We've seen cancer, we've seen AIDS, we've seen a person that was scheduled for bypass surgery. Actually, he didn't have to go. And we also have seen fungal infections. Herpes virus has been neutralized. Epstein-Barr. Asthma, let me see, arthritis. It's very good with arthritis. A lot of minor things that are just telltale signs of things that are going on deeper inside your body. External things are always a sign that something is happening internally. Okay, a lot of people have very dry scalp. They have eczema and seborrhea and psoriasis. That's a sign that something is going on internally inside your body, as well as pimples, as well as boils, as well as athlete's foot. All of those things are candida. It works very well with candida. Now, of course, in any natural healing, there may be a period of exacerbation. Okay, this is very important to remember. Your symptoms may get worse before they get better, and usually they do. That is because, as I said before, the urine will act as a magnet and pull out everything out of the tissues that are deeply embedded into your tissues. So yes, for a very short period of time, you will have a worsening of your symptoms, and then they will subside. Okay, so that is part of the healing crisis, and it's not a reaction from the urine therapy itself. It's just your body trying to rid yourself of the toxins. Wait a minute. Wait 1 second. Let me get this woman. Okay, we've had one patient who was on urine therapy for 3 weeks, and she had to cut her insulin intake in half in that time. But after that, she became pregnant, and her husband just didn't want her to drink her urine through a pregnancy. He was very skeptical, and he pressured. Yeah, I understand that. I'm just saying I really don't have any data. She was the only patient, a diabetic. Yes, she was diabetic. And what I said was that she cut her insulin intake in half in a 3-week period of time while she was drinking her urine. I imagine that if she had gone longer, that she may have been able to bring it down to basically nothing. I think she was on 20 or 28 grams and units, and she went down to something like 10 or 8. Yes. Okay. Wait, ma'am, you've already had a chance. Let me answer some of these other questions. Right. Right. That's right. Okay, the question was the normal pH of the urine. The urine should be between 6.5 and 7.0. That's a very good natural urine. It should be slightly acidic. Okay, you can test it with the little chem strips, But let me tell you this, that you can get a false reading if you eat a lot of protein food. You can get a false reading due to the protein metabolism and the ammonia and the breakdown of the protein. It can give you a false reading, but if you eat a pretty alkaline diet, you'll get an accurate reading, and it should be slightly acidic, 6.5 to 7.0. 1 second. Okay, that's a personal question. Why don't you talk to me after the lecture, and I'll answer that for you, okay? Yes, ma'am. Yes, we've had some people tell us that they've had hair growth as well as just stop the loss of hair. They've used a compress. I had one fellow that was very innovative. He took his baby's diaper and put it on their head and then put a cap over it and wore his baby's diaper. So I think we're running out of time. Our books are for sale. We're in booth 56C, and if anyone would like to talk to Dr. Barnett or I further, you can talk.